Members, it's time and we have a quorum. First item on the agenda. Since the last meeting, 6 information papers have been issued by the Secretariat. And item number 2. Mr. A. Chen, I have something to say about item 1. On the death of multiple egret chicks due to tree pruning, the government provided a preliminary response, and they said they would follow up on the incident and report on the results. Upon conclusion of the investigation, can we discuss the item at the panel? According to the government's response, tree pruning falls under the ambit of the Development Bureau. And on the 21st of June, there was a question at the Council with regards to the trees, and the Development Bureau addressed that question. So perhaps it would be more appropriate for you to follow up on the issue at the panel on development. Ms. Tanya Chen, thank you. On the death of egrets in Type Ho, it was also related to AFCD. According to the laws of Hong Kong, if bird nests are destroyed without permission, it's an offense. I wrote to the AFCD and they confirmed that they did not grant any permissions on the pruning operation or the damage of nests. And we understand that there's a tree management office under the Development Bureau, but if you do not intend to include the item here, but as chairman of the panel on environmental affairs, I will consider inviting LCSC and AFCD to explain the incident. So by that time, I would inform them. I think this might be the best approach. If not, let's move on to the next item. Items for discussion at the next meeting. The government proposed 2 items. First, review of the Hotel and Guesthouse Accommodation Ordinance and the latest progress on youth development efforts. And there was an item on the regulation of private recreational leases, but the administration indicated that they would like to hand over to the next term administration to deal with the issue, and I find that reasonable. Since 8 of our members will join the visit to Israel, including myself, that's why I'd like to change the date of the next meeting to the 18th of July at 8:30 a.m. Well, I cannot make it if you make since I've marked my plans. So I understand that you cannot accommodate everyone, but can the Deputy Chairman preside over the meeting instead? I'm the Chairman of the panel on environmental affairs. I might not be able to attend the meeting on the 17th. Can the Deputy Chairman preside over the next meeting instead? The Deputy Chairman is not with us today, so I cannot give you an answer right now. Chairman, the date has been pinned down. I understand you want to attend the meeting, but I hope you can consider whether you would allow the Deputy Chairman to preside over the meeting instead. Perhaps we will deal with this after the meeting. That's exactly the reason of having a deputy chairman. When if the chairman is busy, then the deputy can take his or her role. We have agreed on the meeting dates a long time ago. I made this recommendation because 8 of our members will not be able to attend. Well, I have to consider the fact that 8 of the members would be absent and we might not have a quorum. That's why I plan to bring the meeting forward. Dr. Helena Wong. Chairman, I understand your point, but can we have one more option and see what the members prefer? On the 18th of July, there will be a meeting at the panel on development as well. I'm also a member of that panel. We have assessed different time slots with the government, and at the end we arrived at the date of 18th of July. I do not wish to move the meeting, but apparently there's no other choice.
理解係，我盡量啊，好冇？
Well, we'll try our best. Very good. Thank you. We'll talk to the Secretariat as well. All right, let us go to the third agenda item, which is the Community Care Fund discussion. Can we ask the administration to come into the room, please?
係。
Now, coming to the meeting today, we have from the Home Affairs Bureau Deputy Secretary Mr. LAU Kwok-fan, Mr. Nick Ao-young, Principal Assistant Secretary for Home Affairs, and Dr. LAU Chi-chuen, Chairperson of the Community Care Fund Task Force under the Commission on Poverty. We have from the Education Bureau, Mrs. Angelina Chung, Social Welfare Department, Ms. Anissa Ma. Thank you for coming. Now, perhaps I should ask Dr. LAU, being chairperson of the Community Care Fund Task Force, to bring us through the paper, or who should it be? Mr. LAU? Yes, Mr. LAU. Yes, perhaps I will bring members through the paper shortly, and then Dr. LAU can speak after. Well, every half year we come to this panel to report on the Community Care Fund work. Since its set up in 2011, there had been 41 items that it had assisted with, and it is some 8.3 billion in total Hong Kong dollars disbursed. As of the end of May, these 36 of these items which have been implemented, and basically 1.53 million people have benefited. And in the annex, we have listed out all the items and the latest information concerning them. Now, where these are pilot schemes, and the government has adopted 11 of these items as regular schemes of service. And since December of last year, since our report to the panel, we have again approved 8 more projects under the Community Care Fund by the COP. And we will see whether we need to come up with extension or amendments for individual assistance programs. Now, if the chair will allow, Dr. LAU will now speak, and then we will be happy to answer questions. Dr. LAU, please. Well, members, in the past few months, the CCF had assisted a number of programs, including the following, and that is subsidizing eligible patients to purchase ultra-expensive drugs, subsidize eligible patients of HA to purchase specified implantable medical devices for interventional procedures, and cervical cancer screening and preventive education of eligible young income women, subsidy for persons holding non-local qualifications to conduct qualifications assessment, and a pilot scheme on providing special subsidy for persons with permanent stoma from low-income families for purchasing medical consumables, and a pilot scheme on relaxing household income limit of the fee-waiving subsidy scheme under the after-school care program for low-income families, increasing fee-waiving subsidy places. And in 2019 and also to March 31st of 2019, we have a new list of medicines which are to be assisted to assist. And further, in terms of dental service, starting from July, the fund will lower the age to 70 or above. And we welcome members and members of the public to give us views, which of course include the members in this panel meeting today, of course. All right. Any questions, please? Now, registered are Wong Pik-wan, Leung Yu-chung, Chan Hung-ban, Cheung Hwa-fong, the chairman, Leung Kwok-hong. Anybody else, please? If not, I would say 4 minutes, including Q&A. Ms. Wong Pik-wan, please. Mr. Chair, I'd like to know more about item 3 there, concerning the subsidized cervical cancer screening and preventive education for eligible low-income women. I'm sure this is a very good scheme to protect the health of eligible low-income women. Now, I'd like to know about the publicity concerning this scheme so as to benefit these women. For example, will there be focused publicity in certain districts? In another panel, we have discussed poverty, and we have identified racial minorities such as Pakistani women and such women. Their poverty is very prevalent, and I would like to know whether you have appropriate publicity to benefit this type of people. Dr. Law. Thank you, Mr. Chair. For the publicity work, we have asked a few NGOs to help us do this work. And first of all, they will start the publicity with their service target persons. And also, it will be extended to other areas. For example, the Home Planning Association, for Family Planning Association, they do in vaccination for young women and or young girls. And the parents very often accompany these girls to come for the vaccination. And through publicity targeted at these people, and also for women who are already benefiting from the service of NGOs, they are also covered in the publicity. We do not have any focus districts as such. You mentioned racial minorities. Yes, these NGOs also serve racial minority women as well. Well, Mr. Chair, I'm sure having the NGOs do this kind of publicity work saves efforts on the part of the government. But the government should have a plan, I would think, for this kind of NGOs to do their publicity. Because the NGOs are basically just going through their network to reach that target. But the government should be more clearer than they are as to what target audience you want to be able to reach, so that the NGOs really do cover the groups that we want to serve. Now, if we know that there is a district with a concentration of racial minority or new arrival women living in subdivided flats, etc., I mean, we've done so much research and studies. Can we perhaps find out what their network is covered by these NGOs and whether they cover all our targets? And if it is insufficient, perhaps we should find ways to supplement them. Who will answer the question, please? Mr. Aoyang? Yes, if I may supplement. Now, concerning Ms. Wong's concern, we are in the know, and there are interactions with racial minority groups to get their support. And also in printing pamphlets, there will be 6 languages which will be prepared, and also in APIs and internet videos, it is also intended to cover these people. Now, in terms of Mr. Chair, concerning the young children care, why is it being amended? Is it because, well, actually your time is up. Maybe we can, perhaps my question can be answered by the administration by written form. Basically, why is it adjusted? Is it because not enough people have enrolled in the program? Yes, Mr. Chair, as there's been 8.3 billion expended and 36 programs have been implemented so far by the fund, and this is good in covering those who have not been able to be covered in the existing system, and 11 have been regularized by the government, so that is positive. But I see that there is another 20 billion or close to 20 billion which is still in reserve. That is a great amount of money. Perhaps we can strengthen each of the projects. For example, in medication, even though for certain medicines, for example, in treating cancer, you have added new medicines in the list, but still we receive written submissions from the ill. They've all the time. I mean, they cannot sustain the very expensive drugs that they need. And these are very, very expensive drugs, and they are really under a lot of financial difficulty given that. Can you perhaps strengthen that program? And another is the no subsidy people, so-called the annual people. They are staying in these subdivided flats, and there is no date for them to move into the public housing. And in hygiene, in safety, it is a problem. And also for many of these landowners of subdivided flats, they charge unreasonable utilities fees. Can there be perhaps more help for this type of people?
Dr. LAU Kwok-fan, on the expensive drugs, different views have been shared. When implementing these programs, we have to rely on the scientific committee of the hospital authority and on their clinical experience and the actual efficacy of the relevant drugs before we can decide which drugs will be incorporated into the CCF or the Samaritan Fund. For the CCF, we do not impose a cap on the budget on drugs. If the scientific committee of the HA feels that certain drugs can be included, then they would make applications to the CCF. So I think the HA is well aware of the arrangement. As for the annual individuals, there is not much I can add because we have discussed this issue at LegCo for many times. I've always said that if we can come up with a way to to help CSSA recipients who are paying expensive rent, we would consider them. And we have been listening to these individuals. For drugs, can you introduce a pilot scheme? DHA has not included them on their list, but the reality is that a lot of patients do not know of the existence of such drugs. So can you have a pilot scheme on this? Drugs on the CCF list are incorporated on a pilot basis, and the HA is responsible for incorporating any drugs onto the standard formulary or Samaritan Fund. So some drugs are about to be incorporated, and they are on the CCF list in order to accumulate clinical experience. Mr. Ben Chen, thank you. On the elderly dental services or dental assistance program, a lot of elderly people need dental or filling services or even dentures. There were no such services provided by the government in the past, and the CCF plugged this gap. However, the age requirement is 80 or above, and this year it will be lowered to 70 or above. We still think the bar is too high. The government should set the bar at 65. Why doesn't the government lower the bar to 65 years old? Is this due to financial reasons? I hope the government can tell us whether they would consider lowering the bar to 65. As for subsidized drugs, we hope that the list can be expanded. A lot of patients of rare diseases desperately need these drugs to save their lives. The CCF is providing subsidized drugs for 12 or 20 months, but these patients might need drugs for life. Can you explain to us the procedures of incorporating drugs on the CCF list to the standard drugs formulary? A lot of patients hope that these drugs can be included on the standard formulary. As for the annual persons, years ago, assistance was given to those living in expensive subdivided units, but the subsidy was dropped. And the CCF has a reserve of more than $20 billion. If a subsidy is to be given to the three new or the annual persons, are you in position to do so? As for the dental assistance scheme, the CCF mainly covers movable dentures, and before dentures are fitted, relevant dental services would be given. We have been lowering the age limit from 85 to 75 to 70. This is not about money, but the availability of dentists. I think all of you would know that it's very hard to make dental appointments in the private market. Right now, about 1,600 dentists are providing services, and we have secured the services of 600 volunteer and NGO dentists, and the number of service places have been increasing since 3 years ago. But the fact is, these dentists are only helping out elderly people through their spare time. Of course, we hope that they can spare more time. That if we lower the bar to an even lower age, then the waiting time would be even longer. So our strategy is to provide services for those aged 75 to 80, and we will extend the range to 70 to 80. The HA is required to review the cap 1 year from now, and the method of incorporating certain items. So we hope that the pilot scheme on ultra-expensive drugs would be effective, so that we can obtain more information for incorporation into the standard formulary. What about the annual persons? I have nothing more to add because it has been covered a number of times. Mr. Christopher Chung. Chairman, I'm also interested in the work of the CCF. Not only can it help those in financial difficulties, the CCF can also build a caring culture and build a harmonious atmosphere. Earlier, the government provided a paper to the establishment subcommittee, and the donations injected to the fund has been dropping, and in 2016 to 17, the donations only amounted to about 72,000. So has the government considered the reasons for the drop in donations? Is it due to a lack of effort by the CCF? What measures do the government have to improve the donations? Mr. Law, thank you. When we look at the donations to CCF, when the CCF was first set up, a lot of donors who committed to major donations made payments in years. That's why we saw higher donation amounts in the first 4 years, and subsequently we did not reach out to the business sector to solicit donations. But of course, anyone who wants to support the CCF can continue to make donations. Right now, the reserves of the CCF amount to about $20 billion. So in recent years, our focus was on discussing with different sectors and providing support to different groups. So that's the focus of our work. Any follow-up questions? If not, it's my turn. There are 8 new assistance programs under the CCF, and I do support some of them. How would the government take comments on board? What is the current mechanism? Is there a cap on the number of assistance programs, or do you have a number in mind? Or are you going to welcome any suggestions? I want to talk about the ultra-expensive drugs as well. The pilot scheme will last 20 months, and with a total funding of $117 million. So you will benefit 10 to 16 patients. That's way too little. So each patient will get about $4 million worth of subsidy. If these patients are made to pay themselves afterwards, they would be in great difficulty because a lot of them have no work. So the number of beneficiaries is very low, and that would lead to difficulties in vetting. In other words, when you decide who to benefit, are you going to review this mechanism? Are you going to find out how many patients are in need of these drugs, rather than waiting another half a year or a year for review? As for recommendations of new programs, they might be from NGOs, advisory meetings, any LegCo panels, so they can come from anyone. Once we receive recommendations, we will explore their feasibility with the relevant government bureaus and departments. If we feel that the programs can be implemented under the CCF, we will carry out certain procedures, and there is no cap on the number of assistance programs or funding. On the ultra-expensive drugs, most of these drugs do not serve to cure the diseases themselves. Once, there's a chance that patients might need these drugs for life. Even after the drugs are incorporated onto the standard formulary or Samaritan Fund, there is no time limit. In other words, the drugs will continue to be prescribed. However, a few years later or 10 years later, new drugs might surface, and that's another issue altogether. For the ultra-expensive drugs, we can argue that anyone can be in financial difficulties, and very few people can afford $1 or $2 million worth of drugs every year. Even let's say if the drugs cost $3 million a year, we will provide a $1 million subsidy, and the patient only needs to pay 20% of their assets. But as I said, the methodology of calculation would be reviewed after a year. For these patients, regardless of their assets, they might eventually use up all they have to buy these drugs, because very often these drugs are for life. So this is beyond financial considerations. Next, Mr. Leung Kwok-hong.
Chair, this is a time when the much-needed rain is needed. Now you, Dr. Law, you are now the person responsible. And you have identified some functional constituency LegCo members to make us pass certain resolutions by the LegCo. That was in the past, but I still cannot forget that kind of experience. Now, the Community Care Fund is your baby. We know that. And December 21st, 2016, we had passed certain resolutions concerning the Community Care Fund, and that included some functional constituency members, unless they were not at the meeting. I mean, this is a crazy idea. This Community Care Fund is illogical in its conception. Well, the societies has progressed, and those who were not able that society was not able to care for, such as the disabled and certain sectors of people, they were left out of the safety network. And the setup of the community care fund is to lower and exclude mercy and exclude empathy from our existing system. And we're saying this society does not have a system to help you guys who are needy. We will use another way, use a charity kind of a way to help you instead. I mean, in other societies, these donors would have been taxed and the money would have gone to the government. They need not have donated the money to the community care fund. That's the first drawback. The second drawback is that, let's say, the nil people, and they have a lot of problems, and you say that you want to subsidize them for their rentals. But this is because the land had been sky high in their prices. That is the reason for causing these problems. How can you go forward like that? Now, or if you say the community care fund is to help people who are left out of the network, for example, those in public housing, if they cannot pay rentals, the community care fund would not subsidize them. And those who need to take long-term medication, I mean, those who are ill are in already a very bad state. And it's been 2 months. You said that by summer there will be a midterm report, but in fact, this is no longer your baby. How can that be? I mean, now that you are Deputy Secretary for Home Affairs, do some more for Hong Kong. Lau Siu-lai, well, I very much agree with Leung Kwok-hong. I mean, for Community Care Fund, in fact, what it is doing is actually, it should be the work of the government. Everything under the Community Care Fund is pilot. And this kind of attitude is problematic because it shows that the government is not taking care of that particular service. But in any case, I am most concerned about the disabled, the pilot scheme covering the disabled elderly. And they have been waiting for this kind of service for a long time. I just want to ask about the details concerning this kind of service. And you say that there will be 4,000 spaces over 3 years. But in fact, waiting for the service is useless because from voluntary helpers to nurses to medical staff, it is insufficient for providing this kind of service to the needy in this sector. My question is, how do you add more hands, more voluntary helpers, for example, and whether this will be regularized after 3 years? And another question is that there is a case management scheme. I would like to know how many cases would each case manager be responsible for? Ms. Ma, you will answer the question? Yes, Ms. Anissa Ma. Mr. Chair, now for this scheme, it is different from the composite household service scheme that we already have in existence. There is a queue for the latter, and those who are eligible for this home or household care scheme, there need not be any assessment on abilities. Now, as for the disabled elderly, we would want to, through this pilot scheme, be able to provide them with the help as early as possible. We want to identify those who are slightly disabled among the elderly, and then they will be given a priority for getting the service. As mentioned, because they are somewhat disabled, we will, in our assessment, look at their self-management capabilities, and usually they have very high self-management capabilities, and we will come up and we will have the professionals to help them come up with a plan for the elderly in taking care of themselves. Well, I appreciate the plan, but all along, it's been said that there is a lack of frontline staff, including voluntary helpers and social workers. How do you add more hands, manpower to your social workers? That's my question. And also, when will it be regularized, this scheme? And thirdly, how many cases is each case manager responsible for? Now, we would want to put more resources into the scheme and be able to provide this service. And the service will be benchmarked to the service vouchers that is extended to the community. As for after 3 years, whether this will be regularized, because this is a pilot scheme at present, we hope to be able to evaluate the scheme on its implementation. We will have outside organizations to assess its efficacy and also the model of implementation and the direction of the service. Chan Chiu-hong? There's another question which had not been completed yet for the previous member. No, please proceed. Her time was up. You can go on the queue again and ask the question after in the second round. Mr. Chair, this is such an easy question. How many cases does a case manager take up? I mean, the administration had talked rubbish and wasted so much time and couldn't answer even such a straightforward question. Now, Dr. Law, I congratulate you. You were a social worker yourself, and now you're going to be the secretary. You will be responsible for welfare, and I hope that you will rectify the catastrophe that you and Carrie Lam had inflicted on the welfare sector. Now, you've been chair of the Community Care Fund for so long. You would know this, and that is a lot of the work should have been done by the government, but they don't do that work. They don't take it up, but rather put it to the Community Care Fund. If they want to do the work, they can do the work. They are able to do that. Let's say preschool service. It was catastrophic. And there are so many pockets to the community, to the government, the Community Care Fund, the Lottery Fund, and the Jockey Club basically can be dipped into freely by the government, but they do not provide that kind of service. And they set up the Community Care Fund. Of course, it is better than none. At least there is some room, some good work that the Community Care Fund had done, and it's helped a lot of people. But still, I don't understand. Why do you not serve the N-nil people? And you are flooded with resources. You have 20 billion in your reserves. Why do you have to be so stingy? Why don't you help these people? And you, of course, said that these were that someone will have to take up the work. I mean, Dr. Law, now that you're in the driver's seat, you will have to take up this kind of work. You cannot say that you will help one sector and not help another sector, because I don't feel you have any love at all or any care at all. You are cold when you come to this meeting. Now, and I also do not understand a lot of disabled persons, when they come to 60 years of age, their special care subsidy is then cut. I don't understand. And the ultra-expensive drugs, why do you have to use the assessment criteria adopted by the Samaritan Fund? I mean, for retirees and retirement fund, the retirement fund of retirees are also put into their assets. And that is how the Samaritan Fund assesses their assets. Now, because they are not forthcoming with their subsidies, and that's why the Community Care Fund will have to step up. But these ultra-expensive drugs are to save lives. Can you, in this area, refrain from using the assessment criteria adopted by the Samaritan Fund, which is a 3-generation evaluation? Well, your time is up. Chan Chi-chuen? Now, I would like to know whether the two are related or not, the Community Care Fund and the Samaritan Fund. Now, when we first approved the Community Care Fund, there was such discussion already. Now, I know in the past few years, the Community Care Fund had not been proactively seeking sponsorship or donation. Is it because you think that it already has sufficient funds? Or do you think that the government will be injecting funds? And if it is the latter, what is the timing for the next injection, please? Mr. Low? Well, as mentioned, the balance now for the Community Care Fund, CCF, is 20 billion. So at present, our main focus is to identify the needy persons as well as the projects. And as mentioned, if members feel that the government should be more proactive in publicity and asking for donations, we can go back and think about this and perhaps carry this out. But of course, we welcome public donation every year, but we do not have any major publicity programs that we are planning at this point. Mr. Chair, there's my other question which is not answered, which is if there's more money, will they do more? Well, Mr. Chair, we have sufficient funds to support more projects and programs. Mr. Chair, because when we come to the Finance Committee and in there may be more questions, but then the panel is not asking the right questions, and we don't have the relevant answers. I mean, my question was, if you're not proactively asking for donations, but of course the commercial sector and business sector, they are doing all sorts of charitable projects as well. And we were asking the small group or the task force, but Dr. Law is going to leave the task force. He's going to be the undersecretary.
Does the SC feel that something needs to be done? I think you just need to send people letters every year. This is very simple. But apparently they did not decide to do that over the last 2 years. Is this something you can consider? We can certainly continue to solicit donations, but as I said, the two are not related. The creation or formulation of new assistance programs is not related to the financial pressure, and the key is on whether the assistance programs would help. Thank you very much. I don't want to raise the same question at the Finance Committee, so please be more proactive and think about how you can solicit donations. At the very least, you should issue letters to potential donors or conglomerates or companies. Anything else in response? Yes, we will step up our publicity efforts. Mr. Yu Si-wing. Thank you. We have a lot of similar funds, including the Jockey Club Fund, the CCF, Samaritan Fund, etc. These funds serve to support people under the line, but things are getting more and more complicated. With more funds, then people would have to make applications through different channels, and these would increase the burden on NGOs and social workers. So the CCF is certainly valuable, but would it only be a transitional arrangement instead of a permanent one? Otherwise, there would be a lot of confusion. Of course, I understand that there are different funds in our community, but if it's to be made permanent, can it become part of our poverty alleviation work? So sometime later we can draw the line. So that way CCF would be a transitional arrangement rather than a regular one. The private companies might think that the CCF already has a hefty reserve and there's no need for them to make any more donations. So I think that would be one improvement to the current arrangement. So would the government incorporate the issue into the poverty line or poverty alleviation work? The CCF's reserves stand at more than $20 billion. Well, of course, everyone wants more money, but sometimes if we have too much, it's a problem. For example, it might discourage donors. So would the government or CCF consider drawing a line every year? Would the government draw the line or a target which must be reached every year? Otherwise, you might give the impression that you have too much money, because that might discourage donors in the future. Deputy Secretary. That is the current arrangement of the CCF. The CCF addresses groups of special needs which are outside of our safety net, and the government would support them. The CCF would also incorporate pilot schemes. They would accumulate experience and assess the sustainability of the program and estimate future demand. Once these pilot schemes are in place for 2 or 3 years, a review would be conducted to see whether they would be regularized. In the past, 11 programs were regularized into the government's plans. As for hard indicators every year for the CCF, this might not be ideal from a policy perspective. Because we might be putting resources into programs not really worth supporting. Dr. Junius Ho, I support the CCF, and I acknowledge its role. In today's paper, I saw a lot of different assistance programs and their details, but this is rather confusing. You said 1.53 million people have benefited since 2011, but how many people have actually benefited? You spent $8.3 billion in 44 assistance programs, and in 36 APs, you spent about $5.3 billion. But all these information are hard to digest. Can you compile a chart, just like other charities like Oxfam, on your administrative costs, etc.? If you show us a diagram or a pie chart, then it would help us understand the information. I suggest you to compile a pie chart on the actual number of beneficiaries. For instance, for rental subsidy in 2011-2012, you gave out $33 million and benefited 22,000 people, and the same went for 2013-14, 14-15, 15-16, etc. And 17,000 and 14,000 households benefited respectively. But the actual number of beneficiaries was only 17 to 22,000. If we benefit the same people every year, we cannot tell how many people actually benefit. Can we help them become self-reliant? As for the allowance for expensive devices and drugs, 420 people benefited. I think this is a good program, but what about the distribution of our subsidy? The seed fund was $21.5 billion, and you spent 5.3 or $8.3 billion. The growth was substantial. It was equivalent to an interest rate of 2% per annum. So this leaves a good impression. If you can compile a chart while you are spending substantial money, so you have to reflect this fact to the public. It's easy to criticize, but not many people are patient enough to read about the good things you did. So if you can compile a chart, you can show people what you want to do and what your plans are in the future. But we need to help. We want to see a vision on how you want to help people. Thank you. Thank you very much. We regularly report the CCF's efforts to LegCo, and information is also uploaded online. We will think about how we can make the information even more presentable to the public. Any further questions for the first round? Mr. Roy Kwong. I might not be able to allow questions for the second round. Mr. Roy Kwong, 4 minutes. Thank you. One of the most criticized aspects of CCEF is the cancellation of subsidy for the annual persons, and there's no policy support for these people from the government. The reason for cancelling the subsidy was that public rental subsidy was not included on the policy address. When I approached tenants of subdivided units, and the cancellation of the annual person subsidy is very harsh for them. And I'm concerned about the sustainability of the CCF. as I understand, the donations have been going down in recent years, and within the term of CY Leung, the donations have been going down. And the donations they receive from the tycoons is also short of the mark. So the bulk of the money comes from taxpayers, and some also come from LegCo's funds. So this is like pocket money in another purse for the government. For certain issues not covered by different policies, they would resort to the CCF. So the CCF has always been plugging the gap. But I have been very unhappy at the CCF since the cancellation of the annual person subsidy. So what is the way forward for the CCF? The CCF also has hefty reserves because they are unwilling to spend. So how would the government address that? Deputy Secretary, thank you. As another member suggested, apart from the initial fund, and we also have fixed assets vested in the Hong Kong Monetary Authority. As of March, the relevant investments amounted to $3.2 billion. So the principal amount can generate extra revenue. But as I said, the amount of donations would not affect the availability of funds for worthy programs. We would go ahead anyway, so there's no need to worry about sustainability. First of all, were the donations short of the mark, and were the donations dropping? This is not a matching fund, and we encourage donations. When the fund was first established, we had substantial donations paid out in instruments the first few years. Did anyone go back on their promises? I don't really understand what you mean. The donations are from the business sector as well as the public. We would discuss different arrangements with them. So that's why you saw big donations the first few years. That's all for the first round. I want to allow more time to members for follow-up. How many members would like to speak for the second round? Dr. Helena Wong, Dr. Lau Silai, Dr. Fernando Chang. Anyone else? If not, I would not accept further questions for the second round.
2 minutes each, including Q&A. Ms. Helena Wong. Chair, about the dental service for the elderly. Well, many elderly, they come up to the LegCo to ask for this service, so it is much welcome, this service. Now, I see that the age was 75 or above. That's the age requirement, and now the proposal is to lower it to 70 or above. But in fact, for certain old age benefits, it's 65 or above, such as the OACA, so OALA. So my question is, can you not lower it to 65 or above? What are the difficulties, and how can we overcome these difficulties, if there are any, in lowering the age? Mr. Chen, in fact, I've answered that question as well just now. The bottleneck is actually in the supply of dentists. We have these caring dentists already volunteer dentists already, but it is insufficient, and we do not want the queue to be overly long, and therefore we have lowered the age from 80 or above to 75 or above, and now starting July 70 or above. Now, Mr. Chair, another question. Has there been any discussions concerning the addition of dentist training and supply of dentists with the relevant departments? Well, Mr. Chair, we haven't. Well, if that is the case, Mr. Chair, then they have not proactively interacted with government departments in solving the problem at its source, and which is insufficient supply of dentists. Any follow-up? None. Lau Kwok-fan, 2 minutes. Leave time for the administration to answer the questions, please. Now, I asked the question, yes, you have added the resources. Is there enough staff? And it's the same question. Have you followed up with the government departments for them to add more people so that there are sufficient frontline people to take care of, as I have mentioned earlier, the elderly? So this is something that is relevant to you, because even if you add more resources with the lack of frontline people, it's still not going to be effective, because there is insufficient staff to help you. So my question is, have you done anything to help to solve the problem at its source, and that is add resources of frontline staff? And also my previous question, how many cases does one case manager take up? Mr. Chair, we actually go on 2 legs. First of all, we would not say that we will resolve the problem of insufficient supply of manpower before we provide the service. The two go hand in hand. This is exactly my question, isn't it? In asking you as to how you solve the problem of insufficient manpower. Mr. Chair, concerning taking care of the elderly, it depends. It really has to do with the image of the profession, the training, the encouragement of different people entering the professions, and also the remuneration, etc. It has taken you so much time to answer the question, but you're still not able to answer the question. Ms. Lau, this is not a question for the Community Care Fund. It is a question for the relevant departments. But it's a responsibility of Dr. Law to talk to these departments and solve the problem. Now, we have remaining one other question, and that is the number of cases that the managers take up. In the next 1 to 2 years, there will be a review concerning the long-term manpower planning, and also the cases that the managers take up. It is not in this round of review, though, concerning how many cases a manager take up. Mr. Chair, concerning the ultra-expensive drugs, I would like to know the difference in the division of labor between the Samaritan Fund and the CCF. And I would like to know whether the CCF will adopt another evaluation standard apart from the Samaritan Fund's one, because theirs is really too onerous. Now, I will not repeat myself concerning the difference between ourselves and also the Samaritan Fund. But again, concerning these ultra-expensive drugs, very often these drugs are to be used lifelong. And the calculation is that even for the middle class, with selling off all their assets to get these ultra-expensive drugs, it will render them basically depleting them of their financial resources and assets. So we will come up with a evaluation method that will be useful and feasible for the CCF. And if it is found to be a good way forward, then the Samaritan Fund may well adopt this as well. Now, for instance, there is a co-payment ratio, highest 30%, that is, and the CCF will pilot making that 20% instead. And the Samaritan Fund can consider adopting the CCF methodology, and the CCF standard will become the Samaritan Fund standard. So this is a pilot part of the methodology. I heard that the HA will review this in a year. I do not know how this can be reviewed by the HA. I mean, this is a CCF work, isn't it? How would the HA be involved? All right. Now, I think our time is up for this particular agenda item. We will be going into the next agenda item, which is Avenue Park at Kai Tak. And we have Mr. Lau Kwok-fan, Secretary for Home Affairs, Mr. Yeon Tak-keung, Commissioner for Sports Home Affairs Bureau, Ms. Doris Lee, Assistant Director, Leisure and Cultural Services Department, Mr. Michael Chiu Yat-on, CEO of the LCSD, and Mr. Edward Tse, Architectural Services Department, and Chu Po-kwon of the Architectural Services Department. And members, please note that this meeting will not be extended any later than 10:30 because we have to return the room to the LegCo. First of all, I would like to ask Mr. Lau Kwok-fan of the Home Affairs Bureau to bring us through the paper. Mr. Chair, this is a straightforward paper, and basically we're putting into place all the parks and the open space and facilities in the different districts. And for the Avenue Park at Kai Tak, this is our topic of discussion today, and perhaps members will have questions. If you're all in agreement, then in this legislative year, we will go to the PWSC and also the Financial Committee, and in financial year 2018-19, we will commence works. We welcome questions. Now, members, just to remind everyone, because this is a public works project, according to 83A of our rules, if you have any declaration of interest, would you please do that before the beginning of our discussion here? Any questions from members, please? Helena Wong, Lau Kwok-chung, Lau Mei-fan, and myself. Any others? None. 4 minutes, including Q&A. One big one first. Now, this is a much awaited for item. Well, since Kai Ching Tak Long estates have been moved into, we have been talking about this Avenue Park, and it's now inhabited by 13,000 people in this area, and it is in the Kai Tak overall planning, but it's not been developed so far, this Avenue Park, and it's always been this wasteland, and which had been wired off. And in fact, the residents at Kai Ching and Tak Long couldn't even cross the street because this area is wired off. And also, it is breeding pests, mice, mosquitoes, etc. And also, not even the government departments could go into the wired-off area to do any cleaning. So, the Democratic Party is very much in support of this park because this is in keeping with the aspirations of the residents there. And but we see that this will not commence works until 2018-2019. We would urge that this be expedited. I have two questions concerning this park. The first one we want to see that because this is very near to the two estates, that is Kai Ching and Tak Long estates, in between those two estates, and it links up to the Sha Tin Central Rail. My question is concerning the fitness area. It is in the right-hand side. But we do not see any other areas in the park where there can be fitness equipment or facilities where people can do some exercise on them. And because there are no gyms or other relevant facilities around for the people living in the area to do some morning exercise, that is why I would like to see more fitness equipment installed in the park so that the residents around can do some basic exercise. I hope that this is not going to be confined to the fitness area because these two estates are rather big. If you place it in the east, can you also place some on the west or along the tree-lined avenue? And secondly, because this is near the Kai Tak station, I would like to know whether there is any canopied walkway, and that is to say people walking across the park perhaps can go across the park to the Kai Tak station without getting wet on a rainy day. Thank you, Mr. Chair. Oh, Mrs. Kwok. Now, concerning the fitness equipment, the location is to make it family-friendly, to make it close to the children's play area and the basketball court so that the family going to the park can be using these facilities at the same time but still be looking after each other. And we will look for, given this suggestion, look for other areas where fitness equipment can be installed. And we will be talking with the Architectural Services Department to see whether there are other appropriate areas as well. Now, as for Ms. Wong's question about walkways, there are canopied walkways leading to the Qinglong shopping mall and also the Kai Tak station walkway. Yes, there would be canopied walkway connecting these 2 points. Now, Mr. Chair, I understand. I heard the question. I'm not saying the fitness area is to be moved from the area that it is intended for now. There are people who are not family, who do not have children, who will be using the play area. I do see space for the fitness areas. Lau Kwok-fan? Lau Kwok-fan? Yes. We welcome this, and this is a big park. I would like to know about facilities, for example, ancillary facilities for the nearby estates. How much will there be? For example, I only see one basketball court for such a big residential area. Will there be more such leisure facilities in this park? And also, for Kai Tak, there is a very clear theme, and that is sustainable development. I would like to know for this park, are there solar panels, etc., which are sustainability related, which will be included into the park, please?
I'd like to invite the RKSC to address the second question. In terms of sports facilities, if Mr. Law looks beyond this park, for example, at the Station Square, there is some space, as well as the Kai Tak Sports Park and its surrounding area. There will be public sport facilities available in the future. So in terms of the entire planning, we are not just talking about this fitness area. And I trust that residents will not only stay at the park. So are you saying that there are enough sports facilities in the entire planning? On the solar panels, we have incorporated green concepts in the project, including energy-saving facilities, and we would use recyclable materials as well as some trees that are fast-growing. If details are available, can they submit more papers? We would like to know about the sustainable development of the park. Sure, that's possible. Ms. Edward Lau. I talked with the two district councillors responsible for Kai Cheng Estate and Tak Long Estate. They know that the Avenue Park will be discussed at LESCO. They told me that this should be done as soon as possible. Residents at these two estates have moved in for 4 years. And they are still bothered by an empty piece of land in between the estates, which is sealed off. And the conditions are still not satisfactory, so they hope that this project can be completed ASAP. So I'd like to relay this message to fellow members, and hopefully we can support this project. And the district councillors also have some questions. Over the course of construction, will residents be affected? As you know, this park is located between these two estates, and this is a common passage for the residents. So during the construction phase, will residents be affected, and will there be any mitigation measures? And on the map, we can see that the park is very spacious. Even though there are pedestrian passages, a lot of the areas in the park are uncovered. So will the government introduce more passages in the park to connect to shelters or public transport facilities? Mr. Chair. We have more than 80 rain shelters in the park, so there will be shelters for the public. Our plan is to implement parallel tendering, and with the approval of the Finance Committee, the project can commence construction in 2018. What about the impact on residents? During construction, while no piling is involved in this project, we will carry out noise and sewage mitigation measures according to the EPD's guidelines. Please work with the two district councillors, Hon Yun-ting and Hon An-hon. So hopefully it can be done as soon as possible. I have two questions. The first, is there any connectivity between the Avenue Park and the Kai Tak Sports Park? For example, will there be a jogging lane or jogging trail for the public connecting the both? That would be another element of sport. In terms of the funds, in this year's policy address, the chief executive said he has earmarked $20 billion for the next few years to enhance leisure and sport facilities. So is this one of those 26 items? Yes, that's why we are giving it a higher priority. Well, there's only one basketball court, so the element of sport is not very obvious. After the $20 billion worth of projects are done, you might not have a very high element of sport. We are talking about leisure and sport facilities. We also have sports stadia and swimming pools. They would be studied in the next stage. So we are implementing about 5 projects every year. So we are already at full steam. For sports facilities, we can discuss them later, including sports grounds and stadiums. Commissioner? The Avenue Park will connect to the Kai Tak station of the Shaolin Central Link, and the Kai Tak station will connect to a large station square. And through the station square, you can reach the Kai Tak Sports Park. The station square will have a covered walkway connecting to the sports park, so access will be very convenient. As for joggers, the station square is spacious enough for different types of exercises. Mr. Ray Chan, I'd like to ask about the station square. And we are given layout plans. I wonder whether 3D plans would be given later. Very often these squares are occupied by people who play loud music and dance, and sometimes there are conflicts. Behind the Chung Kwan sports ground, a small stage was built with some barriers in order to minimize conflicts. Is this something you will consider? I'd like to ask about the washrooms. Will there be gender-neutral washrooms? I hope these would be incorporated in future LCSC facilities. I read reports this morning that some blind users were stopped from using accessible toilets by the staff, even though they apologized afterwards. So I think more training is needed on LCSC staff so that they know who can use the accessible toilets. For transgender persons, I hope that they wouldn't face any problems or obstacles. I agree with Mr. Chen. We will reinforce training in our frontline staff. On the design of the square, I'd like to invite RKSD to give us more details because there are some unique designs. It will be unlike our typical amphitheaters because there will be unique designs. As for the washrooms, apart from barrier-free washrooms, we will also have universal toilets. They can accommodate people of different genders and different needs. Mr. Chair, there are 5 parts to the entire project. First, the covered walkways, they would be flanked by trees on both sides. There will also be a landscape corridor from Tat Long Estate to the future station square. It is a long passageway and there will be some greening. So apparently that space is not suitable for dancing. And in the center of the tree avenue, there is a wider section, And we have come up with little hills, and we'll also have a basketball court and bathrooms, and there's also connectivity to Sampo Kong. So greening is the focus of our design, and we try to avoid hard pavement. If we see people dancing or taking out other activities, we will explore with the LCSD how the designs can be improved. Ms. Chan Chi-chuen. Chairman, I have two questions. First of all, according to the conceptual plan, the tree avenue would be lined by trees and flowers, but please pay attention to the species of the plants, or else you might face some complaints from the public on pollens. And if you have nice flowers, more people would visit. The secretary said that there are plenty of facilities in the entire Kai-Tak area, but since the commissioner for sports is here, can he submit a table of all the sports facilities in Kai-Tak to the Public Works Subcommittee later? I only see one basketball court here, so will there be sports facilities nearby? I know that there would be an indoor sports center at Kai-Tak Sports Park, which can be used for badminton and other activities. But for outdoor facilities, how would you plan them? According to the site plan, the toilets are very small. Perhaps it's very hard to spot. I don't know how many cubicles would there be. And there's a fitness area and basketball court. There are toilets on both sides, but they seem quite tiny to me, so I hope they can be reinforced. In terms of the species of flowers, I think there's a culture of flower watching among Hong Kong people. So for the tree avenue, well, I agree that we should only have a single species of flowers. With today's discussions, I think by the time we come to the PWSC, we can let the public know that that different sports facilities are available at the greater Kai-Tak area. As for the toilets, as Mr. Chen suggested, there are toilets on both sides of the park, and those two toilets have symmetrical designs. And at the men's toilets, there are 4 latrines and 4 cubicles, and at the women's toilets there are 4 cubicles, and we also have barrier-free toilets.
Anybody else for the first round of questions? Hon Kwon-yu, Leung Kwok-hong, anybody else? That will close the first round after these two members, 4 minutes each. Hon Kwon-yu. Well, Mr. Chair, very straightforward. I think this design is good. I agree to the Secretary and also Ms. Chan in saying that the thematic garden with a single species of trees is good. Now, Hong Kong parks seem to be all the same. So I'm asking, apart from this thematic garden or tree-lined avenue, will it be more characteristic? For instance, in the Versailles, we see a very long stretch of pools, water pools. Now, I see that there is 1.2 kilometers of a stretch there in the garden. If you can think of some kind of pool or water display, it can be very nice visually indeed. Perhaps, you have consulted in twice, and if we can perhaps, how about make it more romantic, make it a long stretch of water instead of a pathway. Is that possible? And also, there is 1,600 kilometers across for this park. Can there be a lavatory at some midpoints there? That's the second question. Third question, a lot of people are keeping pet dogs now, and going to the parks, these people would want to bring their pets as well. And there are restrictions, of course, in the park in terms of admissibility of the pet dogs. Perhaps we can be more human in our approach and perhaps carve out an area where people can bring their pet dogs. Now, Mr. Chair, concerning the lavatories or toilets. Now, the members see that there is a space in the middle, but in fact we have, these are landscaped slopes. And the estates themselves would also provide toilets as well. And that is why we are basically installing toilets just on the left-hand side and the right-hand side of the park. And these facilities cannot exceed 10% of the overall area of the parks. And that is why we have restricted the toilets to be installed in these areas and to that kind of size. And also, because this avenue is tree-lined, it may not be appropriate for there to be buildings or for there to be waterworks as well. But on the other hand, your romantic design, that is your water display, will be incorporated in the station design. So next time when we discuss the station design in the Public Works panel, you will be able to know what the overall outlook would be for this area. Leung Kwok-hong, Chair, you're saying that people can go to toilet by going back to their residential estates. Well, that's silly. Well, if that is the case, then the parks need not include any toilets or any small food stalls, etc. These are privately developed developments. I can see that on Muk On Street there are these private developments. As for the two public estates, Kai Ching and Tak Long, I can see that in the plan here, but I see that clearly, even though they are a little bit behind, a little bit far further away from the park. Now, for the Victoria Park, in the past, they planted bamboos around the toilets. And in Indonesia, there is no real enclosure to speak of for their toilets. But of course, Hong Kong is densely populated, and you may need to plant trees around the toilets, I understand. Now, if you look at Tak Long Estate, walking to the main park, it is a bit further than walking from Kai Ching Estate. And they have to go through the Mok Choi Street before they can access the thematic garden and the tree avenue. My question is, can you attract people from the estates to come to the park. That is very important. And another question, Mr. Lau said that we should complete the works as soon as possible. I'm in agreement to that, because for any projects you have, you want the projects to be perfect. But if we say that it can be potentially problematic, then you may stall right there. So what we want to do is not to have no debate on this proposal. I mean, if you're talking to residents in Tak Long Estate and Kai Ching Estate, they would probably object to this. But for the private developments, and that is the Novo, and also there is another private development, this would be more like a backyard for them. It would be so convenient. Now, DAB is the biggest party, and you have 2 people in the Executive Council. Please expedite this. Well, I'm not included. I don't have a say. I can only protest outside of the door. So do speak up, men and in the future women. So don't blame this on us. I mean, this has been debated for so long, and the so-called well, people have asked for bicycle lanes, and I don't see any bicycle lanes here. I mean, what you do, is it practical, or is it a facility for yet another ribbon cutting? I mean, we have to benefit the users. Metal and concrete is not the right way. In the parks, basically, you're uncomfortable being in the parks. You don't even want to sit there because there's just too much concrete. Well, actually, I live nearby. So, Mr. LAU Kwok-fan, I'm asking you to expedite this project as much as possible. Okay, that's all for the first round. We have a little bit of time. We have 2 minutes for second round. Ms. Wong. Yes, Mr. Chair. Concerning the toilet compartments, this is less than the 1-to-1 compartment. I mean, for the ladies, it's 8 to 9 compartments. For the men, it is 4 urinals and a few compartments. And even if you make it 12 compartments for the ladies' toilets, it is still 1-to-1 or less than 1-to-1.5. So I regret that. Now, I think you should approach the design of the park from the user's point of view. Perhaps you can develop some jogging lanes and also pet gardens. The housing estates, of course, disallow keeping of pets. But what about the private developments nearby? So before you go to the public works panel, perhaps on dog parks and also jogging lanes and also little children's cycling area, if you can add those to make this park more to be more utilitarian, that would be good. Yes, Chair, we heard that. We will be talking to the Leisure and Culture Department to see how we can optimize it. As for toilets, there is no buildings ordinance requirements as to how many compartments of toilets are to be installed in the parks. And for the ladies, well, it is 9 compartments, but have we heard the view? Perhaps we can add more compartments to the toilets. We have to close the question session here. I have a question for members. You are not in objection, members, for the government to take this to the Public Works panel. Is that right? Correct. Any other business? No other business. We close the meeting here. Thank you for coming.